Those who are new here, I'm Dr. Jade. I'm a board-certified family medicine physician. I'm certified in obesity medicine. My why in primary care is to help my patients transition to a healthier lifestyle and a healthier weight. And I am so excited to just be serving my hometown community. It has been a pleasure and a joy. At Inspire Primary Care, we are enrolling new primary care and medical weight loss members right now, and that is at inspireprimarycare.com. No I in front of Inspire. And if you all are able to join me live today, I'm happy to answer any questions you have live. I have a couple of questions that were submitted to me that I will answer, and I'm going to give you the three important things to look for in your primary care doctor as you join. I see a few of you have joined, so drop in the chat, where are you joining from? And let me know, what are some things you look for in a primary care physician? So let's jump right into it, all right? 3 things to look for in your primary care physician. This is really important. Your primary care is 90%. Your primary care is 90% of your healthcare needs, so you definitely want to be connected with a physician that will provide you with high quality healthcare. So let's talk about number 1. That is, you want your primary care physician to be accessible and unrushed. You want your primary care physician to be accessible, and you want the experience to be unrushed. So I told you this is also a story time, so I'm going to share a little story with each of these 3 things I'm going to share with you. So the first thing is, I had a patient, a new member, join our practice yesterday. They were transferring to our membership medical practice from their insurance-based physician's office. They went to call their insurance-based primary care physician, and they waited on hold for an hour to make an appointment. Okay, they were on hold on the call line for over an hour just to try to make an appointment. Once they got on the phone an hour later to make an appointment with the receptionist, they were told that the next primary care physician appointment with their doctor, their insurance-based doctor, is at the end of August, in over 4 months, okay? 4 months away for the next appointment. And they told me that each time they had an appointment previously, they were in the room with their physician for less than 5 minutes, and the doctor was looking at the computer screen most of the time. All right, so this is the opposite of what we want. We want your physician to be accessible, meaning it's easy to make appointments, like our members here are able to have their own QR code to self-schedule appointments via phone, video, or in person easily, and I am a text or email away for them. They can text me during business hours. They can email me 24/7. I answer that within a business day. I am accessible to them, all right? And their experience is unrushed. So instead of a 10-minute visit, like in an insurance-based office, their visits here at Inspire Primary Care are 30 to 60 minutes. So I want you to ask yourself, is your primary care physician accessible? And is your experience unrushed? If the answer is no to either of those things, it is time to upgrade your primary care experience, all right? Number 2 thing, as you're joining, drop in the chat, where are you joining from? And here we go. We're doing story time and Q&A. So number 2 thing to look for in your primary care physician is you want to have a great relationship with your doctor and a trusting relationship with your doctor. It truly is a partnership. It should be a collaboration. This is not a paternal relationship where we just tell you what to do. It really should be with somebody who you've gotten to know, who you trust, who you feel like you're being heard. So the story time component to this is, I have a member who's been a part of our practice for about a year now. And at our last appointment, and they told me I could share this, at our last appointment, they shared with me, wow, Dr. Jade, this is the first time in my entire life, this person's in their 50s, this is the first time in my entire life I have had a physician who I truly have a relationship with, who I truly feel heard by, and where it feels like a true collaboration, where you hear me out and we make decisions about my healthcare together in agreement. And so that is what we do here. I care for my members like family, and I want to ask you, are you with a primary care physician where it does feel like family, where it does feel like it's a relationship, where you trust them, where they know you, where they know some of the struggles behind the scenes that are happening, where they know your children's names and what you do for a living and the new stressors that have occurred? These are all so important to have. So do you have a great relationship, a trusting relationship with your primary care physician? If the answer is no to that, then it is time to consider upgrading your healthcare experience, all right? As you're joining, I see a few new ones joined. Drop in the chat, where are you joining from? We're doing Q&A as well, so if you have any questions, I'm happy to answer your questions live. And we're doing a little story time with our top 3 things to look for in your primary care physician. So number 3, y'all ready? All right, number 3 thing to look for in your primary care physician is a physician that has a wellness focused approach, a whole patient wellness focused approach. Commonly, what I'm seeing in insurance-based offices, simply because the structure, the model of the businesses is a high volume business, so they need to cram as many patients in the room on the schedule as possible and get the doctor in and out of the room as fast as possible. Although there are great, phenomenal physicians in the insurance-based system, that structure, that business model leads to a physician having to be in and out of the room in minutes and having to make quick decisions. And the fastest decision is going to be prescribing a pill or sending a referral. Okay. So when you're with a physician that has time for you, okay, our model here with a membership model is quality, smaller amount of patients, quality, detail, VIP experience. And so when the incentive is high quality, then the quality of care naturally goes up. And so I want to know, does your doctor have a wellness focused approach? So because I have more time for my fewer amount of members, all right, more time for my fewer amount of members leads to us being able to discuss more than just pills, looking at the root cause of disease, looking at other things that may be contributing, like their nutrition, their sleep, their stress, making personalized wellness plans. All right. These are the things you want to be able to have time to do with your primary care physician. It's really important to look at the wellness in addition to screening for health and medical concerns, in addition to making sure you're up to date on your health maintenance and your labs, and referring to specialists as needed, but not as a default because there's not enough time. So I want to ask you, are you working with a primary care physician who has a wellness focused approach? If the answer to that is no, then it is time to consider upgrading your primary care experience. I see Donna says she is joining from Las Vegas. Hello, it's good to have you here. Drop in the chat where you guys are joining from if you have any questions, and I'm happy to answer them. So that is the 3 things, you guys. 3 things that I want you to be looking for in your primary care physician. Number 1 is, are they accessible and is your experience unrushed? Number 2 is, do you have a great relationship and a trusting relationship with your doctor? And number 3 is, does your physician have a wellness focused approach? If the answer to any of those are no and you're in the Las Vegas area, I would love to be your doctor. We are now enrolling new primary care and medical weight loss members at Inspire Primary Care. Our office is perfect for busy professionals. We do care for businesses as well with our corporate membership. So if you're a business owner who has employees, we would love to keep your team healthy. And so if you have any additional questions, I don't see any in the chat as I'm scrolling the chat, but if you have any additional questions, I definitely would want to answer those. Feel free to DM me at our website at Inspire Primary Care, no I in front of inspire.com. There is a link at the top to schedule a free meet and greet with me. Those are on video. We hop on video. I'm happy to answer your questions. I do want to give another shout out to one of our members. Speaking of a wellness focused approach, we have 2 members I want to shout out. One member was a part of our practice for 3 months, and they have lost not only 35 pounds in 3 months of being a part of our medical weight loss program. They told me that they're most excited about the fact that we have reversed their type 2 diabetes. So the hemoglobin A1C, we just got their lab results back, has gone from 7 down to 5.2 in 3 months of being a member of our practice. Not only have they transitioned towards a healthier weight and we're almost at their weight goal, but we have also helped them to reverse their type 2 diabetes. So that is what we're doing here at Inspire Primary Care. And if that is the type of healthcare experience you're looking for, high quality, high accessible, unrushed experience, a relationship with your doctor, I would love to care for you. Drop any other questions you have. I will answer it on the next live, and I am looking forward to caring for those who are the right fit for our practice. Have a great day. Bye.